Will you cheat the camera that way a little bit? Doctor, just kind of clip a little bit more. There you go. Good morning, everybody, and welcome to our live Ask a Doctor series, where we look for questions from you, the audience, and we sit here with an integrative medical physician. It's usually Dr. Rita Ellithorpe. So we love to make this participatory. You can ask your questions over in the chat section on the side of the video here. You do need to be logged into YouTube to do that. You can also email your questions into us at office@tlcdoctors.com and just put in the subject line question for YouTube or live Q&A. That'll get forwarded to us and we will answer those questions as we can on the following episodes. So thanks again for joining us, and just a couple pieces of information for you. One, this is not meant to be medical advice. We don't practice medicine through YouTube, but this is for educational purposes. So we will answer your questions as if we were approaching it generally with a patient in the office, but we do encourage you to follow up with these questions with your healthcare provider. If that's us, great. We're accepting patients here at Tustin Longevity Center in Orange County, California. But if you have a provider outside of here, absolutely do follow up with these questions with them. Also want to mention a couple things. We are doing this now twice a week. We are here every Wednesday morning at 9:45 a.m. Pacific, every single week. And Dr. Ellithorpe is doing her own longer format, sometimes an hour, sometimes an hour and a half, where you can join her usually Monday nights around 5:30 p.m. This week we had to push it back to last night, actually, Tuesday night, but you can join us here. And the best way to stay informed on any of these and all of these videos is, of course, subscribe to the channel, and of course that helps us out, helps with the YouTube algorithms. Like the channel, and better yet, tell a friend, tell a family member about us, and tell them they can get on here and ask questions anonymously or whatever, and we will we'll answer those as best as we can. So thank you for hitting that like button. If you didn't catch it, we did post a video yesterday. Dr. Mitchell did a live broadcast on YouTube where she talks specifically about women's health, vaginal health, one of the therapies that we do here that helps sort of turn back the clock, called Mona Lisa Touch. So if you missed that, go back and look at our videos and you can see Dr. Mitchell speaking about that topic. Okay, well, Doctor, thanks for joining us again.
I'm very happy. I always have fun trying to show a functional medicine integrative approach with our standard training as allopathic physicians.
Yes, absolutely. And it looks like we do have some questions rolling in. And I just remembered I left some questions that were emailed to us on the printer, so I might go grab those. But our first question is from Sean, and Sean asks, at what point do you recommend performing a complete digestive stool analysis? My wife is completing a 3-month food elimination diet after receiving her immunolab test results.
Well, anytime we can actually see how you're processing your food is a benefit. If you're in the midst of a therapy, coming to the end of that therapy is a good time to do a complete digestive stool to add increased reinforcement to the powerful impact that diet has on your body. The elimination diet, taking out foods that your immune system has made antibodies to, would tell you not to eat those foods.
Right.
We have to eat, okay? So if you give your body a 3-month hiatus from eating those foods, we should see a reduction in those antibodies performed. Does this mean you can never eat that food again? No, it just means that maybe you were eating it too repetitiously in a learned behavior through marketing. So yes, you can probably rotate in one food every 4 to 5 days and see how you feel during those 4 or 5 days. If you don't have any problems, then you can reintroduce that food every 4 or 5 days and never eat it more frequently than that. When we get a complete digestive stool analysis, we actually get inflammatory products in the stool. We can see the result of a war going on. We can see how if you have meat fibers, vegetable fibers that are not digested well. We can see the predominance of the bacteria that is in there. We can also see white cells, red blood cells. We can look at short chain fatty acids. We can look for parasites in a very, very heightened manner, really better than what the hospital does. The typical ova and parasite ×3 screen is actually better done on the complete digestive stool analysis. So to answer your question, Sean, finish up that 3-month period of time, then do a complete digestive stool analysis, and let's see how well your discipline helped your wife, okay?
Right, and it does sound like she's right about there. She's completing that 3-month food elimination diet after following her immuno food, so sounds like it could be time soon.
Yeah, I think everyone should have the complete digestive stool done maybe every couple years. It's good to see how this system is processing. You can have smoldering colon cancer and have no symptoms until it's already gone to stage 4 and affected other organs.
Right.
And this is why we're concerned about bloating and concerned about gas and concerned about the type of stools you make, because this is a subtle reflection of this very critical absorption and passage here for getting your nutrients to stay well. And it's been underrepresented in our medical training. So I am so glad I was exposed to functional medicine decades ago to see this value. And I'm glad to see gastroenterologists have finally now gotten on the bandwagon, and I see them prescribing nutraceuticals, natural things that are very valuable. Probiotics are now a common thing at the standard gastroenterologist. They're using natural antihistamines, more antihistamines, and acids like L-glutamine products. So they are, aloe vera. So praise the Lord that we see them doing this. So I'm grateful for all the YouTubes, all the people that have done the grassroots work to make their YouTubes, personal trainers, majors in science, naturopaths, housewives that have just taken the time to do some studies and put up YouTubes on their success with their weight loss. All these reflect that we, the people, can make a difference on this industry called medicine that has been shackled by pharmaceutical-only training, imaging, and surgeries. So bravo to them, and let's just have discussions like this with people old like myself who have been doing this for 40 years and get our perspective on it, because there are some unnecessary things and advice on the YouTube that I think need to be, but for the most part, I think it is a very good movement, all these wonderful things that everyone's doing.
You're right. Now, speaking of the colon and the gut, what is that test that we have seen come around? We actually offer it here, that
Cologuard.
Cologuard.
Yeah.
What do you think about Cologuard?
I think they're trying to replace the need for a colonoscopy.
And it's a little bit more preventive, a little bit more forward-thinking than the invasive typical colon.
Yeah, and of course there is some risk of but there is risk of infection with a colonoscopy.
Right.
People have contracted hepatitis C from this, albeit very rarely.
Right.
And there is risk of perforation, hospitalization, and I have seen patients that has happened to.
Right.
But very rarely, and we are able to manage it. Nevertheless, colon cancer, being a silent killer, is around the 4th leading cause, maybe the 3rd now, of deaths from cancer. So I still think you should get a baseline and probably at least a second one. The recommendation will be made by your gastroenterologist once he sees what your colon looks like. If you have polyps, then you must come back within a few years, because that's the early sign of chronic inflammation in the gut from your diet, from these food allergies and many other things. So yes, but the Cologuard is mailed to you a box, and then you have a little hat that you put on your stool, and you produce your bowel movement, and then you take the entirety of that movement and you have a sealed container. It's about this big, and you send it back. And they do quite a few studies on the stool looking for the genetic signs of cancer, and this has turned out to be very
It's pretty accurate.
Yeah, pretty good.
I don't want to say it necessarily replaces a colonoscopy, but it's good.
It's looking like it may overtake colonoscopies, and of course that will make me happy because I think more people will do screening.
Yeah, can do it at home versus going into the doctor and dealing with the colonoscopy.
Yeah.
So the comprehensive digestive stool analysis, which Sean was mentioning, and then we have Cologuard. Does one are they very different?
Yes, completely different.
So just because you did the CDSA, you should not do a colonoscopy or the Cologuard.
The inflammatory chronic damage,
yeah, okay,
is what a complete digestive stool analysis will tell you about. Whereas Cologuard is looking for evidence that a cancer was produced from that chronic inflammation.
Sense. Okay. Saruchi asked a question in the same topic. He says that I was suggested colonoscopy to be done after 45 years, but no digestive stool analysis was done. Should we first go to the stool analysis before any other process?
I would follow the advice of whoever told you to do this colonoscopy. Right. So get that done. I don't know if you have a high family history of colon cancer.
Right.
That'll make the need for you to do a colonoscopy sooner than the average. At 45, I think they lowered it from 50 years now down to 45 is when you should all of us get your first colonoscopy. But it's a different thing. So please do your colonoscopy, and hopefully it'll be normal, and they will then say at most probably a 10-year follow-up.
Right.
But if they find polyps or inflammation, they'll ask you to come in 3 to 5 years for sure. But you have to stay connected with that gastroenterologist for that advice.
Right.
Often they'll come here and they'll say, yes, I had it done, and I'll ask them, well, how did it turn out? And I won't have the report, a new patient often, and then I'll say, well, I don't know when they want me to repeat it. And I'm saying, why did you even get it done if the doctor is not making it very clear when you need to repeat this thing, okay? So please, whoever that question was, get that colonoscopy done, and then try and find a good functional doctor who will do the complete digestive stool analysis.
Yes.
And that periodically done on you.
Right.
And I honestly believe that those who have healthy gut bacteria, healthy non-inflamed poop, are going to live past 100 years. That is absolutely a fact. And
the gut is really, for a lot of us, the fulcrum of our health.
Exactly. If you're not digesting well, you're not getting the things you need to sustain a healthy immune and body parts.
Right.
It just makes sense. So often they'll say disease begins in the gut because the majority of the world comes to you through what you've selected to eat.
Yes.
Yeah.
Okay.
And then they're modifying it, hydrogenating it, they're glyphosating it, they are making it high fructose corn syrup rich, all these silly things, plus many other heavy metals are in the foods now, and so forth. So we need to be aware of this.
Right. And Sergio is following up and saying it was a preventive measure like a mammogram. So maybe he's saying, or she's saying, there's no history of colon cancer there.
Family history.
And maybe the Cologuard might be a decent choice if you're 45 years old, younger. You could do that instead of the colonoscopy, but definitely talk to whoever ordered that with you. And there are some contraindications for the Cologuard as well too. Okay, so that is all the chat questions for now. Let's hop into some that were emailed in. I have an email here from Jennifer. Jennifer says, after severe UTI that caused delirium, not now recovered, my father-in-law has brain fog and is very withdrawn. What kind of supplements can he take? Did we answer this last week? Okay. So a severe UTI caused delirium, now recovered. My father-in-law has brain fog and is very withdrawn. What kind of supplements can he take that will make him be himself again? Would chelation help?
Well, EDTA chelation will always improve the microcirculation, not only to the brain, vision, heart, and all the parts of the body. So that's always a given. If you have better microcirculation throughout your body, you will live longer and healthier. Antibiotics are very hard on the human body, and we are appreciating now the many decades that we have indiscriminately used prescription antibiotics, which have killed the good gut bacteria. The good gut bacteria is responsible for helping make hormones for the brain, like serotonin. And so there is a book called The Second Brain, Your Gut. And there is so much biochemistry going on in your gut with digestion. Antibiotics can destroy and impact this for, I've seen up to as many as 2 years reported. That's why at a functional doctor's office, we really resist giving antibiotics unless we are concerned seriously about life-threatening or damaging impacts. Most of our illnesses are viral, okay, that come along. But a culture-proven strep throat you have to take so you don't make antibodies to the strep. The other would be the culture-proven urinary tract infections. But we are usually giving our patients all along a probiotic as a lifestyle. If you get an antibiotic, you should take a high-dose probiotic. We have one of the clinically vetted research ones called Probiotic 225. This is a powder that you mix in with water. And then we have the Orthospore, because there are a variety of branches of probiotics that are important. So I would get him on probiotics, okay? I would use high dose initially. I would add an Orthospore. When he finishes the powdered high probiotics, then I would go to orthobiotic, which is a more standard one, or orthobiotic 100, maybe the next step down. So he'd be on 2 probiotics. I'd be very low carb. I would do the chelation therapy that's enhanced with vitamin C. If his gut bacteria were so damaged that he's not making good hormones, he will have delirium and have memory impact from that. The inflammation of it will have done it. So we are made of fat and protein. He needs plenty of fats and proteins in his diet to help restore him. Now, there's probably many other issues going on in this situation, but people are forgetting the brain-gut relationship for our mood and for our cognition. So don't forget that.
Deborah asks if a complete digestive stool analysis is covered by insurance. I don't believe it's billable to insurance. I believe that is a out-of-pocket. And if you need more information, talk to a provider that offers the CDSA. Of course, we do here. And I want to say roughly off the top of my head, I don't think it's a cheap test. I think it's in the high 300s, something around that.
Well, you're getting so much information. Yeah. You are getting bacterial counts. You are getting parasitology. You are getting chemistries done. And along with those cultures. So this is no small test.
Right.
And it takes 2 or 3 weeks to get the result back. I think it's well worth it.
Right, absolutely. And we don't recommend things that we don't think are worth it, but we do try to be cost effective with our patients. And of course, I mean, we could talk a lot about the fact that when it comes to health, we have to make the personal choice of, are we going to just do what insurance pays for and get the same results that the insured population gets, or are we going to look at some of these things, instead of it being an expense, as an investment in our future, right, and in our bodies, which, right, is really the most important thing on this planet that we have is our health.
Right. And if you look at our population here, had no impact from COVID.
Right.
It's as if there was no pandemic at all.
Yeah.
And we have thousands of patients. Right. Our 5 clinicians. We had preventative probiotics taken. We had vitamin D taken preventatively, a zinc-enriched multivitamin that, right, we had them on. We had them on iodine, most of them. We have them on, many of them on quercetin, vitamin C drips, chelation with vitamin C. Yes. So if you want to save money, you want to stay well.
Yes.
So these hundreds of dollars in investments every few years in your life is probably well worth it.
Right, especially the gut being the make it or break it for your whole body's health. Right. You know, what would it be worth if you could invest in yourself, learn some things about your body, see some weaknesses, see some strengths, make some changes, and possibly prevent colon cancer? What's that worth?
Yeah, it's worth everything.
Yeah. Okay, we have another colon question here that was emailed into us. Michelle asks, what do you think of the colonoscopy procedure, pros and cons?
Well, I have to say I'm biased, so it's important for you to know my biases. My brother-in-law, Sandy's husband, David, He was a wonderful man and healthy, Scandinavian, blonde-haired, blue-eyed, healthy guy, and he helped us remodel our house to put it up for sale when you were a child. And we took him out for a steak dinner, and Dad and I, and then about a week after that was finished, Sandy called and said his ankles were swollen. And I thought that was very unusual for a man who's 45 years old. And then I said, that's not good. Please, I told her a few things to do and call me in a few days. She called back, and now the swelling was up to his knees. And then I said, no, he's got to go to the emergency room and get a scan of his abdomen. When they did the scan, they found the colon cancer had metastasized to all of his body parts, and Uncle David died then about 3 weeks later. So I am very sensitive about people getting screening for colorectal cancer. So I am going to be biased on the side of everyone should get one done. And fortunately, the Cologuard is coming along. If your baseline colonoscopy is good, normal, then maybe we can get away with doing a Cologuard and a good follow-up with your doctor, functional doctor, helping watch over this. But very often getting 2 colonoscopies within 5 to 10 years, if your lifestyle hasn't changed and produced any inflammatory changes in your bowel, then that's likely. Now, I can take responsibility for my own health. I've done 1 colonoscopy, and I'm not going to repeat it. Mine was pristine clean, okay? And so I've not changed my lifestyle in 30, 40 years, so I'm not going to repeat the colonoscopy, my personal self. Right. But I will do a Cologuard at the 10-year mark. So there are punctures, there is infectious concern. That is extremely rare. I think the value of preventative medicine, that's what we're all about here. We're about prevention. And so please do at least 1 colonoscopy.
And I apologize for any noise in the background. We're in a working medical office, and we actually have some construction happening up on the roof, and there's the gardeners here, so pardon the noise. Okay, I had a question just emailed into me. The question says, so my daughter-in-law is 6.5 months pregnant. She is not vaccinated. Currently, she's very concerned about getting COVID and now very concerned with the new variants. What would the treatment protocol be if she did get COVID while pregnant, and what are the issues with receiving the vaccine while nursing?
Well, we have grave concerns about the vaccine and its production of the spike protein, and reports of nursing infants being affected and getting bleeding disorders, bleeding through their guts. We even know of 1 fatality from a mother who was vaccinated and her baby passed. So I am not able to recommend the vaccine at this time because I don't have enough information to give informed consent, and that's what you're asking me to do. Well, Pfizer, Moderna, and AstraZeneca, Johnson & Johnson have not provided the full Monty, you might say, of the components of these vaccinations. So I find that very suspicious. They have not made all the information available. Number 2, we have, and that'll just point out to you that the number of deaths reported after COVID vaccines, this is from July 9th, this last Friday, there are 438,441 reports of adverse events from all age groups, including 9,048 deaths, of which 41,015 are serious injuries since December 14th and July 2nd. Now, there is, if you can see this, you can see this is an old copy I have of the deaths due to vaccinations throughout our vaccine adverse event reporting for decades, and here is 2021. So there is something of concern regarding this vaccination. They're not giving us complete disclosure of all that was in and components of this to us, and therefore I would say this should be your answer on whether or not you should get vaccinated. Now, the mortality due to COVID is so low for a 30-year-old, 20-year-old woman that you're
even
talking...
when pregnant?
even when pregnant, is in the 99.9 something percentage rate. So I would say that even if she were to get the virus, taking quercetin, taking vitamin D, taking vitamin C, taking a zinc-rich supplement or immune-enhancing supplement like our immune supplements here, she should do very, very well, and I wouldn't expect any problems at all from this.
Yeah. My wife and I were pregnant right back when COVID hit hard, and there was a lot of fear, uncertainty about it, and she has an autoimmune disorder.
On top of it,
yeah. And right after having the baby, she tested positive for COVID. She got sick. Everybody was concerned. We have some her parents living with us, and they're older, and they have some immune issues too. So she went ahead and got tested, and it came back positive. And you know what? She even with her autoimmune disorder, we got her on the vitamins, got her an IV, and she did fine. I mean, she wasn't happy for about 2 days. Just uncomfortable, but she really weathered it well. So I want to encourage you. You know, this is something. If your daughter's concerned about getting COVID while pregnant, well, there's things that we know that you can do to help to improve
There's
your odds.
hydroxychloroquine. There's ivermectin as well. And what I'd like to point out, we're going to give you some references here. We'll post it at the bottom. Many of these sites are from physicians such as myself who did very well with all our patients. You can check out their websites and their YouTubes. I'll post this. But I also want to point out the European Union database of adverse reactions. They had 17,500 dead reported as of last week in these vaccine incidents. So 17,500 in Europe, and 9,048 here. That's 26,000 dead from the vaccine in the past 6 months, 7 months. So I would say there's some questions that need to be answered about this vaccination. And I just looked at one more piece of information just before I got on air here. And there's a preprint. So this isn't officially reviewed to the point of accepting for publication. But at Research Square in London, they looked at the children in London, United Kingdom, that got COVID, SARS-CoV-2, and they're reporting about 500,000 children over the past 1 year got, 500,000 got SARS. Out of that, there were 25 deaths in the 1 year. Out of them, 19 of them had comorbidities. So these were very ill children. They were primarily Asian and secondarily black. And so you do the numbers, 500,000, 25 died, 19 had comorbidities. So you have to understand that there is really a resilience of health in the young people and even the young adults, the 20, 30, 40-year-olds, and the 99.5% risk for those of us above 65. I chose not to get vaccinated, and I have done, and I've seen the people throughout here. I never missed any days.
Yep.
I've stayed very well. So be reassured, be low carb. Don't stress your immune system with a high carb diet, because every sugar will depress your immune system. So be low carb. Drink plenty of water.
Right. And again, I just want to reiterate, it goes back to personal responsibility. You know, no one should feel pressure to put anything into their body that they're not comfortable with. So you got to make a choice. I know what I choose for myself. I am a pretty healthy, you've raised me right, young guy, pushing up towards 40, and I look at the risk versus the benefit for any kind of treatment, whether it's a colonoscopy or whether it's a vaccine, and say, okay, if I don't do this treatment or if I don't get a vaccine, what risk am I facing? And with this particular virus, we're looking at such a low mortality rate. People my age that get it do fine. I watched my wife, who's a little younger than me, get it and do fine, versus the unknown risk really of the vaccine. And if you are concerned, maybe I would make a different choice. If I was 85 years old, I had comorbidities, I would look and say, hey, what's the risk if I got this, something serious could happen, and the potential benefit. So you got to make your own choices.
Yeah, there was a wonderful article put out by Dr. Richard Fleming. If you go on the YouTube, and I have it listed here as well, there's 2 M's in here, there should only be one. FlemingMethod.com, FLEMING method, METHOD.com. And if you go to that site, that's a 4.5-hour review of all the science from 1999 when gain-of-function studies began, all the patents in the US and internationally, and all the money that went to financing SARS-2 development and manipulating it. And so I think this is well worth your time to go to Dr. Richard Fleming on the internet, FlemingMethod.com. Please watch that YouTube series. Please educate yourself. You can download every document, every patent, every research paper he documents. Dr. Fleming is a lawyer. Dr. Fleming is a medical doctor, and Dr. Fleming is a PhD as well. So this gentleman had somewhere of 99.83% success in managing all of his patients. He lost out of the whole year of very sick people, we're talking thousands, 3 people, 3 only out of thousands. So we doctors have ways to figure things out when our patients need us, and that's what we're here for. So please check it out.
Yep. And I'm going to have to move us towards wrapping up because, again, Dr. Althorpe is going to be seeing patients here. We're a working medical office. But thank you so much for joining us today and for your time. Just one last comment here. Someone said, my uncle got the vaccine for COVID and he developed pneumonia. Thank God he's out of the hospital yesterday. Yes, thank you. I'm glad to hear that. That's good news. Well, thank you for joining us today, folks. And thanks for your questions. Hopefully you found this information useful. If you did, please just take a quick second and hit that thumbs up button. And even better, tell your friends and family about it so they can join us next week. We'll be here Tuesday, 5:30 p.m. Dr. E will be on her own. It's a little bit...
Monday.
I'm sorry. I'm thinking about this week.
Yeah.
Monday at 5:30 p.m. That's a longer format, a lot more time to get questions answered, a lot more time to dig a little bit deeper. Mm-hmm. And then we'll be here Wednesday morning at 9:45 a.m. All those times are Pacific time. And if you subscribe to the channel, hit the little bell, you'll actually be notified when we're doing a video. And if you miss it, you can go back and watch it. All right, everybody. Thank you. Anything else before we go?
No, God bless.
God bless everybody. Be well.
Good.